Hello Preceptors, and welcome to Part 1 of the Pharm 354 course review. My name is Renette, for those of you that don't know me, and I'm the course coordinator for this course. What I plan to cover over these two modules are Preceptor's Resources and overviewing the course, what's new in these ever-changing times, assignments, assessments, your roles and responsibilities as the preceptor, and finally, how to contact me. First of all, I want to say a huge thank you. You are exceptional preceptors that are managing in exceptional times, and we really very much appreciate that you are taking students and introducing them to the challenges of practice. If you're looking for more information, you can check our U of A faculty website. If you go to the Pharm 354 section, you'll find course information, the podcast, the syllabus, some calendar templates there, as well as the quick reference guide. There's also training and resources that you can find there as well, and preceptor benefits and award. So the preceptor quick reference guide is now ready to go. We're just a little bit behind as we needed to make some adjustments for the current COVID situation. You will find in there quick links to resources such as the course syllabus and some calendar templates as well. There's a checklist for orientation, a checklist for students' activities and assignments. There's also some summaries on on-campus services and expectations for students. So please feel free to share this with your pharmacy team so that everyone knows what's to expect from the student and the placement. So first of all, you would like to find your student information. So the students should have their CV or resume posted already, and their learning plan they post 1 week prior to the placement. So for you to find it in CORE ELMS, you would select the student. There's a drop-down menu there. Once you select the student, you'll obtain their information, and at the bottom you'll see where it says student requirements, and in here you'll see it will say their CV and resume, and then you go over to the far right hand side here and you can click the file and open that up and you can see the student's resume. So currently the placement dates are Block 1, May 4th to May 29th, Block 2, June 1st to 26th. We are actually currently looking at some flexibility here of extending these course dates to possibly provide students the opportunity to do placements in July and August as well. When there is a stat holiday, for example, Monday, May 18th, it will be up to the preceptor whether or not the student would work that day or not. It's at your discretion, not the student's. So what are the course implications of COVID-19? Well, first of all, I would like to say that if you have any questions or concerns regarding your student, the course, or if circumstances change, it's really important that you contact the faculty as soon as possible. I've provided you with my email address and my cell phone number as well. Students have been advised to contact Student Services, and they have that contact information. We ask that you be flexible. These are exceptional times. These are opportunities for students to learn more about PPE, prudent infection control, and so much more. Safety is of prime importance for us, for everybody, for you, your patients, your staff, and for students. So it's important that students are not exposed to risks beyond the usual practice. There have been some changes to the course activities. I have removed activities that involve being outside the pharmacy, for example, the interprofessional visit, to keep everyone safe. So some of the adaptations to the course, given the circumstances, is that I would ask that you do a more site-specific orientation to precautions at your site when the student comes. I really encourage flexibility and creativity to meet the course objectives. The course objectives are the same, but how you get there really is up to you and your student. Please keep the care plans very simple and basic. Last year I had students doing care plans on topics that they hadn't even covered, and that really isn't an expectation, so keep it simple. They can do telephone interviews versus the face-to-face. If necessary, you can do some role-playing. As mentioned, there have been some activities that have been dropped, and instead these can be done through discussions with the preceptor instead. These activities are the interprofessional activity and the health education activity, where they would be providing some kind of education in previous years, for example, sunscreen to customers in your store. Obviously, that would not be reasonable this year. And consider including the impact of pandemic to practice in your discussions as appropriate. Again, this is a unique learning experience. With respect to course activities and assignments, if you refer to the quick reference guide, there you will find the syllabus and additional information in the appendix. The student's first assignment is to do their learning plan, which should be provided to you about a week prior to the start of placement, so that it allows you to review it before the students come. The students are first to complete a skills inventory. It helps them assess how comfortable they are with various parts of the patient care process. So that should help them in designing what they would like to work on in their placement or their learning plan goal. After doing their skill inventory, students will state one goal using the SMART format. When they meet with you at the orientation, they should provide this learning plan to you, and the two of you can go over it and discuss the goal and perhaps modify it as what might be appropriate to your store. The student should then post the revised learning plan in CORE ELMS. At midpoint and final, you can touch base with your student regarding how they are progressing towards achieving their goal. And they will post their revised learning plan both after the midpoint and after the final. If students receive a need improvement at the midpoint, they should be incorporating that into their learning plan. With respect to care provider, I am providing a few just tips and suggestions. And again, in this environment, encourage you to be flexible and creative. Prepare with your student prior to initiating the activity of interviewing the student. Discuss the different steps involved and discuss your expectations with the students so they know what to expect. Again, these are first-year students, and some of them have never been in a pharmacy before, behind the counter. We recommend that students observe you, the preceptor, complete a patient interview. The student should prepare and share with you their planned approach so they can role play with you on how they would approach the situation. The students then can conduct the session or the activity with supervision and observation. Again, you may need to be flexible. Some of these may be over the phone. I'm not sure if you have speakerphone where you can listen in. You might have to do some role playing. Again, please be creative. And then they can debrief with you after they've had their interaction with the patient. And you can provide feedback to them at that time. Students should be documenting in the patient profile, but it may require some practice, so they may need some guidance with this. You may wish to have them write it out on paper first before you have them enter it into the system. And all care plans and documentation should be reviewed by you, the preceptor, to make sure that it is okay, because ultimately, again, these are first-year students. The second assignment is a care plan. The students will post one care plan where they have interviewed and provided care to a patient. The care plan should include a BPMH, so they've determined what medications the patient's taking, identified the drug-related problem, and there may not even be a drug-related problem, but that can be identified as well, provide therapeutic alternatives, and come up with the plan to implement, and follow up if applicable. It may not be possible. Again, please keep it simple. These can be simple over-the-counter recommendations that students do. They've also taken COPD, asthma, and smoking cessation in their first-year pharmacotherapy course. And again, it could be role-playing if needed, or via the telephone. Students must complete a minimum of 4 care plans as above, but they only need to post one. And again, you should be reviewing all of their care plans and providing the students with feedback. And as a sort of a touch point, students should have done at least one care plan by the midpoint so that they are on track with the course. Here's just a snapshot of the patient care plan worksheet that the students have to use to help them with their patient care process. And there are some little indicators for you as the preceptor to help you when you're providing feedback to the students. The third assignment is a medication safety assignment. So the students have a number of modules to review on the ACP website, and then they will need to complete a drug incident report form to resolve a real or hypothetical medication error using this ACP report form. Review and discuss it with you, and they need to submit this. They must remove any patient identifiers from the drug error report form. Last year there were students, I had to have them remind them about that. The students will actually be discussing these drug error reports in their second year practice skills lab, where they will do a root cause analysis. There are only those 3 assignments. The rest are activities and discussions, which again have been modified keeping in mind the current situation. They're listed in the syllabus and in the preceptor's quick reference guide. The students are the ones that are responsible for keeping track of what needs to be done. And again, we encourage you to discuss the current COVID precautions and procedures, as well as the role as pharmacists that you're playing as first-line healthcare providers. So I'm going to stop here, and I'll do a second podcast on assessments.